Hi everyone, welcome or welcome back to my channel. My name is April and I have a channel that is devoted to lifestyle, health, and fitness topics, particularly geared to those of us who are Gen X, baby boomers, and beyond. So I welcome you to my channel and I welcome you to part 2 of my video concerning how I tore my Achilles tendon and how I recovered without surgery. So if you missed the first video, I encourage you to look at that because that gives an overview of how I was injured and how my tear was diagnosed. I had a injury on the tennis courts and it was quickly diagnosed by a few medical providers post-injury. So here we go on part 2. After consulting with my orthopedist, he gave me 2 treatment options for my Achilles tear. One would be a non-surgical, less invasive, minimally invasive treatment plan, which would involve casting or wrapping rather my injured leg and placing it in a position where my heel was facing up and the ball of my foot in a downward position. Kind of like, ladies, if you're wearing a heel, how the ball of your foot would be lower to the ground than your heel, which would be higher up. So it's this position that is particularly helpful once an Achilles tear is diagnosed to help start the recovery and healing process, whereby it places the 2 injured parts of the torn tendon closer together to assist with healing, to assist with the tendon reattaching via scar tissue. So I was placed in a bandage, and my leg was placed in my foot, rather, ball of my foot was placed in that downward position. And I was sent home to determine whether I would want to go the non surgical route or whether I would want to go to proceed with surgery. So over the next few days, I really weighed the pros and cons of surgery versus not having surgery very carefully. One thing I wanted to mention is in deciding whether I wanted to have surgery, my doctor gave me a very short window to have the surgery. It was their opinion and their practice that the best outcomes for a surgical repair of an Achilles tear occurred within a 2 to 3 week time frame. So I was given 2 weeks to schedule the surgery if I wished to proceed in that direction. And just going back to my first video, if I had decided to proceed with the surgery, this would give me a better chance of having or regaining some of that explosive movement that I previously had. And it's the preferred route for a lot of people who are very active, who are involved in sports. And even though I'm a 40 something, I try to remain active. I do play tennis. So being explosive and having some mobility and movement and quick reaction on the court was very important to me. So with those things in mind, my decision was to actually proceed with the surgery. So my tear occurred in the lower part of my right leg, just above my heel. This area, I've come to know, is referred to as the watershed zone. It's an area between the calf muscle and the lower leg where 75% of Achilles tears occur. And it is thought that these tears occur in this region predominantly because of the lower blood flow and blood supply to that zone, making it more prone to injury. The other factor in having tears in that zone is the fact that the lower blood supply is common for that area. That also affects the time and the length of time that it takes to heal a tear. So once I made the decision to proceed with the surgery, over the next 2 weeks, my main focus was to be able to create some semblance of normalcy whereby I was able to move around, perform my daily tasks, and create the least disruption to family life as possible. That was easier said than done. One of the most critical things was just to be able to safely move between, rooms within my home. And that was, you know, I designed a process where I was able to utilize my crutches and a knee scooter that I was given from the doctor to move around as safely as possible. One of my major concerns was getting in and out of the shower. I have a walk in shower. So, what I did was I purchased a shower seat, and I was able to use that while taking a shower. I also purchased um, a bag that would cover my injured leg, which was wrapped in bandage, and prevent that area and bandage from getting wet. So that was also helpful. But then I needed a way to get into the shower because I couldn't step in using my injured foot, and I couldn't hop in using my foot that was not injured. So the way I went about that was having another seat outside of the shower door that I would sit on and then turn and maneuver my way into the shower. I did also purchase some shower safety handles to install in the shower so that I could grab onto those, pull my body up into the shower, and then down to the shower seat that I had in the shower stall. So that was an involved process. But it's one of those things that you don't think about until you're in the position you have to think about those kind of things. So I was really concerned during that time period of moving about safely, especially in the shower, and not creating a situation where I could fall or I could get injured. For the most part, that worked up until the day of my surgery when, wouldn't you know it, coming out of the shower, all was, working normally, operating well, but I lost my balance. And in order to catch myself, I had to place weight on my injured leg. And let me tell you, the pain was unlike anything I had experienced since I had torn the tendon. um, the one saving grace for me at the time was believing that, I'm going to head to surgery anyway today. So hopefully I haven't further injured that area, but it was already torn. So how much more can I do? So one of the things that I learned is when you tear your Achilles tendon, you are at an increased risk of forming blood clots in and around the area of the tear due to the slowed flow of blood in that region. So I was particularly mindful of it. From what I had read, I learned that the chances of a blood clot were not particularly high, but that there were some symptoms or signs that you should be aware of. So, I kept that in mind as I went through the 2 weeks preceding surgery. That 2 week window, I was given prescription medication for the pain. Now, the pain wasn't constant, but on occasion, it was a throbbing pain that was pretty high on the pain scale for me. I believe that I have a high pain threshold, but at some points in time, I felt that I needed to take a pain reliever to alleviate the pain. One thing that I noticed, however, during those 2 weeks, especially towards the end, right before surgery, was that I was getting a persistent pain in my right calf. And when I looked at my calf, I noticed that the area immediately to the back of my calf was red. And when I touched it, that area was very sensitive and it was very painful. I didn't know what to make of it, but I was concerned. The day of surgery is here. I had prepared the night before by not eating or drinking after midnight. I'm very nervous, but I made it to the hospital and I've been admitted. All of my vitals have been taken. I've been given my hospital band, and I am preparing to get a a spinal tap. I was given a spinal tap, and the reason why I was given that was so that anesthesia could be delivered to numb the lower half of my body so that surgery could be performed. And it was expected to, be an outpatient procedure. And I was, resigned to the fact that this is what had to be done, but also very hopeful that the surgery would be a success and that I would have the best possible outcome after this tear. So while I'm being admitted and prepared for surgery, I did have an opportunity to meet with my orthopedist. And I've actually met with him a couple of times. In fact, actually, after the spinal tap was administered. So, right before they were about to wheel me back to the operating room, I mentioned to my orthopedist that, well, I sure hope that the surgery is successful, and I hope that it gets rid of the pain in the back of my calf. When I said that, he gave me a very puzzled look and he said, "You have pain in the back of your calf?" And I said, "Oh, yeah. I've had the pain for the past several days. It's very painful to touch. It throbs when I touch it. And this is something new that has just kind of popped up in the past few days." So when I said that, he said immediately, "Well, you know what? I think that we are going to have to stop in our tracks, and I'm going to have to take you down to diagnostics so that they can perform an ultrasound on your leg." He told me that that pain that I was describing could be indicative of a blood clot. And if it was in fact what he suspected, that I would not be having surgery that day. So that was definitely a wrinkle in my plans for surgery. So fast forward, my doctor takes me down to imaging, and an ultrasound is performed on my calf. And wouldn't you know it, I had two blood clots in my calf. So once that was discovered, I consulted with my surgeon again, and he confirmed that I would not be able to have surgery that day, and the window to have surgery would have passed because I would now have to go on blood thinners to dissolve the clot and to thin the blood and prevent any chances of those clots breaking away and traveling, in my system, which is extremely dangerous. So there went my attempt to have surgery. So once it was discovered that I did indeed have two blood clots in my calf, the same calf of the same leg that was injured, surgery plans were off the table. Talk about a change in plans and a detour that I wasn't expecting. I was discharged from the hospital and sent home. Once again, my leg bandaged and put in a downward facing position. And I prepared for this journey of recovering non surgically from an Achilles tear.